So I was diagnosed 13 years ago after being a real health nut, exercising, eating right and everything my whole life, and all of a sudden I ended up in an emergency room, which what we later found out was a cholangitis attack. And soon after, and many tests that we all go through, invasive tests, learned that I was diagnosed with PSC, which was a total shock to myself and to my family. And then what happened was we of course started checking on the internet and trying to learn everything we could about PSC, and what was on the internet at that point was very frightening and very inaccurate. It said that as soon as you're diagnosed, you have 5 to 10 years to live, and we were not happy with that and figured we would start a foundation, see what we could do. And my daughter's a lawyer, so she did all the legal work for us, and we started and figured we'd give ourselves about a year, and if it didn't work, we would give it up. And at the end of the year, we just had huge representation throughout the country of people, because no one else was doing this. And now it's 12 and a half years later, and we have people all over the world that come to our yearly conferences. And the first conference 12 years ago, we had 80 people, and this year in 2015, we're up to about 325 people at our conference. So we're very excited about that. Our next conference is in 2016, June 24th to 26th. And each year we have our conferences at a different medical center, mainly because there's so little known about PSC. They each have sort of a different bent on what we should be doing or not. So in 2016 we'll be at Yale University working with Drs. James Boyer and David Assis. And it's also a really unique opportunity for us in 2016 because we are also collaborating with the International PSC Study Group. So those researchers from all over the world will be meeting in the U.S. for the first time at Yale the same weekend. They will be speaking at our conference, and then on Sunday we're doing a joint program with talking about PRO, where we will put the patients and the doctors together to talk about the results of that survey we're going to be handing out ahead of time and deciding where we're going to go from there. So we're very excited about 2016.